So good afternoon. I'm going to introduce myself first. So my name is Mariana, and I'm from the Plastic Surgery League of Federal District, LIMACIP. And João, you can introduce yourself.
Hi, I'm João. I'm the president of Plastic Surgery League of Universidade Católica de Brasília, and also a member of Academic League of Surgery, Plastic Surgery of Federal District.
So we would like to introduce Dr. Rod. He is a world-renowned surgeon, plastic surgeon, and we would like to thank you, Doctor, for your time, for your interest to be here and teach us. You're a reference for us, so thank you so much for this opportunity to have this lecture with you.
All right, well, thank you. Well, I'll talk a little bit about some of the new innovations. We can talk about that, and then next time we can talk about how social media has transformed plastic surgery. And so let me just share my screen.
All right.
And can you see my screen now?
Yes.
Yes.
Okay, so I'm going to slideshow, and you can see that now?
Yes,
Okay,
that's
good.
fine. That's
All
fine.
right, so what I'm going to talk about is some new innovations in plastic surgery, and these are called, radiofrequency technology, and then the options for facial rejuvenation. And obviously, these are some of my disclosures. And of course, we invite all of you to come to our meeting, our world famous cosmetic meeting, Dallas Rhino and Dallas Cosmetic, this coming March. So what are the options really for facial rejuvenation? I mean, there's a lot of them, but everybody today wants to have minimally invasive surgery. And what does that mean? That means that you have fillers and neuromodulators and things like that, but most people want to have non-surgical rejuvenation, and only 15% proceed with rejuvenation. So the classic obviously is, the classic is to have a facelift. And in a patient like this that actually has had truly a facelift, that's really what you want. And however, most patients don't want to have a facelift. And certainly a patient like this is a great candidate for a facelift because she just has a lot of significant lipodystrophy. However, other patients want non-surgical rejuvenation. And that's really what we're going to talk about. So, and I'm going to talk about above and below the mandible, along the mandibular border. So how do we define that? And what do we mean by that? Above the mandible, there's a lot of treatments to the back of the mandible, and then the border, and then below the mandible. So I'm going to go through those. Above it in the back is the masseter. And the masseter is really one of the strongest muscles of the human body. And you can soften it with a neuromodulator like Botox. And it's amazing how that works, because you can actually use this to correct bruxism, to correct shaping and fullness in the area, and then you could also use it for TMJ problems. And it's unbelievable how important it is, and how actually it works well, especially even in the temple area. And that works unbelievably. And then in the front, of course, you can have buccal fat. Now, buccal fat is very popular, but the problem is most of the time people don't need it. But this gentleman does need it. He has too much fat in his lower jawline, right in front of his masseter. So the way we take care of that is we actually, we do buccal fat removal. And buccal fat removal is very, very important, because when you see a patient that's had buccal fat like this, then you know that they have had a nice result with shape and contour, and in a patient like this as well. So this is very important to understand, to only do it in a certain number of patients. Now, what about on the jawline? On the jawline itself, you can add a filler to the mandibular border. You can do it like in this patient that has a beautiful jawline, and you can actually re-enhance the jawline in this area, and you can redo this obviously along with the rhinoplasty, to give her a beautiful jawline. And that's really something that is very remarkable as well. And then you can go below the mandibular border, and there's all kinds of things to do in the neck. You can use things called Kybella, which is really deoxycholic acid. And then you can use cryptolipolysis, which is cool sculpting. And then you can use liposuction. And then I'm going to talk a lot about radiofrequency body contouring. So Kybella is really bile acid, which has been used to, and I'm sure it's approved in South America, but you can use it, inject it non-surgically, and you can do it in younger patients such as this, and it works very effectively. But the downside is that there's a recovery as well. And then there's cool sculpt, where you basically freeze the fat. This is actually after one treatment, and it looks pretty dramatic. But liposuction still is the gold standard. You know, the gold standard is liposuction and contouring. And then really, when you have a patient like this, male, thick skin, you really need to do something more aggressive. And that's called radiofrequency skin tightening. And really, that's really what you really want to do is radiofrequency skin tightening allows you to do thermal stimulation both of the skin and in the deep dermis. And I think that's really what you want. And you want to contract the dermis. You want to remove some of the fat, and it'll thicken the dermis. And so that you can have different modalities of this. So Morpheus, which is radiofrequency skin tightening through the upper part of the skin, to AccuTite and FaceTite. So let's really look at what all these modalities do. They really tighten the skin in a safe bimodal manner because you have a safety device both externally and internally. And this allows you then to really get the contouring you want. And you can do FaceTite in a patient under local, or in this case in the operating room. And you really can, excuse me, soften this area. And so you do this, you FaceTite this, then you do liposuction, and then you can see the amazing transformation here. And here's that same patient with FaceTite. And this is really amazing transformation in a patient that has had FaceTite with body contouring. And likewise, in this patient, same type of configuration, FaceTite with with neck contouring and a chin augmentation. And that's really quite dramatic results. So if you do both of them together, that even gives you a more remarkable result, because it gives you both the deep tightening and then also the superficial tightening of the radiofrequency skin tightening. And these are new modalities that are very popular. And what radiofrequency skin tightening or fractional microneedling is, it really allows you to go both superficial and deep, and you get the tightening deep and the superficial as well. Here's a classic patient like that, young patient, really just wanted to have a more youthful looking neck. And so what we did is we did both FaceTite with radiofrequency skin tightening. And you can see that this is fairly remarkable, the changes in the contour in this patient. Another patient also had a rhinoplasty. We also did FaceTite and Morpheus, and you can see that she's had a very dramatic improvement in this area. So you can combine the two together. You can do it also in patients that have had facelifts, and you can do it to enhance their results. And I think that's really a remarkable way to do this. You can see these are other examples of that. And then sometimes you can do subdermal fractional remodeling alone. And I think that's really important. And here's patients that just with my nurse practitioner just had radiofrequency skin tightening without anything else. Now, these are not surgery, but they're two different treatments spaced 8 weeks apart. You can see it's quite dramatic, the results that you see in these patients. You see this in this patient again that had previous face and neck lift and just wanted a little more tightening. And I think it's really dramatic. What's really dramatic is in a patient like this, had two passes, two treatments with that fine wrinkly skin. It's very dramatic. And all she really needed was non-surgical skin tightening. So these are patients that really, I think, are momentous changes. The wrinkly patients, this patients that has very minimal wrinkle, in these areas. These are really remarkable. And these are patients that are non-surgical candidates. Also patients like this that don't want a tummy tuck, you can only tighten the skin with a methodology like this. 2 passes spaced 8 weeks apart. Pretty amazing. So this type of treatment is really a gap treatment for the rejuvenation patient. And I think that's really what you want to talk about. And it's a gap treatment for those types of patients that really want to have options besides surgery. And once you are a filler neuromodulator cannulate, as soon as you start getting early jowling, you really should get something in the radiofrequency involvement. And really, I think what this really tells you is that there are other things you can do. So I would just share with you that when you go and see a patient that has aging, you want to make sure that you don't just say you need surgery. So those are all things that are very, very important. And so I'm happy to entertain questions before I go on to my next one, which will be on social media. Do you guys have any questions? Mariana?
Dr. Flavio asked, like, are there enough studies or any evidence of difference between surgery and non-operative regarding long-term results?
Yeah, well, that's a very good question, because the long-term results in these patients is really about maybe 3 to 4 years, okay? And the long-term results in facelifts is about 8 to 10 years. So again, these are just patients that aren't candidates for facelifts. If you don't have jowling in your face, you shouldn't be doing surgeries. Before that, we would say, well, that you have to wait. Now you can actually do things much earlier. And these are very good techniques and technology that are very safe. And you have to obviously learn how to do it.
Okay. I think that's the only one until now, the only one question.
Okay. So, I mean, these are just a flavor. And obviously, as medical students, you probably haven't, have you had surgery rotations yet?
Doctor, as we have like students from the first to the last year of medical school, I think some yes and some others not. So It depends.
All right. Well, that gives you an idea of what's possible. And then, so, I mean, those are all the things. I mean, obviously surgery is the most important of all, but as you saw, most people don't want to have surgery. And it's probably no different in South America and Brazil, because people want to just they want to look good without surgery, which sometimes is possible and sometimes it's not. So, but, well, let me give you another talk that's going to be on social media. How's that?
Okay, fine. Oh, just another question.
Okay.
Claudio asked, good afternoon, Dr. Rohrich. And how about the scars after the more invasive procedures?
Well, yeah, there are scars there. If you have a facelift, the scars are inside the ear, back up into here. And, there are scars. There are definitely scars there. And you see that. But, they heal with time. But everything you do with surgery will leave a scar. As a plastic surgeon, we will learn how to hide them. So that's the most important thing. So that makes sense?
Yes, that's it.
Yeah.
Okay.
All right, I'll just kind of shift gears a little bit. This will be obviously this will be social media. And this will be a little bit maybe what you all really, I think, understand it. Do you see this now?
Yes, we can see.
Okay. All right. So I'm gonna share with you, how social media really is transforming plastic surgery all around the world, and I think that's really important to know. And I think one of the most important things we need to understand is that social media should be used to impact people, not to impress them. And I think that's really one of the cardinal rules. And it's really an essential way that each of us interacts with people today, unfortunately, or fortunately, and it defines our specialty as plastic surgeons. And it certainly is something that you understand. You know, over 50% of the world is on social media, and in the US, it's about 90%. And that's a huge increase in 2021. And most people use social media, adults, and 90% use it for business. It's unbelievable how it's transformed all of plastic surgery. And to this day, you know, Facebook and YouTube are still the most popular platforms. And then Instagram is up there. And look how TikTok is just blowing it up. So, you know, today social media is transformed websites. I mean, websites are the landing pages only. They no longer do anything, but they're the landing page of what our marketing has done. So gone are the days of print and TV media. Google, YouTube is excellent. Patient reviews, of course, are important. And then social media. And it really should be part of every plastic surgery training program. And of course, in the United States, it's not part of any. So it needs to be an effective and essential part of the core curriculum. And we certainly, many of you who follow me know that it is an essential part of what we do every day. And that should be the core curriculum of the residency program. So, and millennials certainly now are the largest generation of the labor force since 2016. So the baby boomers and the post-millennials are all way more populous than any of the baby boomers. And you can see that in the you know, the Mark Zuckerbergs and all of the people that really are the hallmark of today's generation. And so, you know, we have talked about it, we've written about it, you know, both the millennials and many of you are part of the Gen Z, which is really an important part of this next generation. But we all must have the passion and respect and integrity of each other to be who we are. But, you know, the current leaders want to know, and they want to know what we don't know. And I think, let me summarize that in that we need to be better communicators with each other and with millennials. And that's in a leadership style, that's in an education style as well. So what's different is that, you know, you all grew up with computers, with social media. I didn't. So you're tech savvy, you're very knowledgeable, you're very transparent. And really, plastic surgery is completely different today. And it's changing because in the past, everybody would talk about your reputation and publications and how much podium time you had and live surgery, but that's really being replaced by social media, Instagram, YouTube, webinars, and Facebook, and all of these things are very different. Instagram Live. So this is what the consumer sees, but this is what social media's influence is. And so let's go through that online, whether we like it or not, it defines us. And I think that's really important. So patient reviews are important, even though none of them are validated. And the identity of plastic surgery has been completely redefined. And most of the people that are claiming to be plastic surgeons aren't even plastic surgeons on social media. So you can see that the amount of social media presence is really skyrocketed in the past several years, as has its importance, even from 5 years ago. So remember, in plastic surgery, as one door closes, another opens. So you need to know who's there, and you got to seize the moment or it'll seize you. And you have to be at this crossroad. And you as upcoming surgeons and leaders need to make sure this is an educational tool that you must balance. And this really allows you to access as a patient educator, communicator, and you get feedback from your patients. Just look at all these things that were not there 10, 15 years ago. Instagram, Airbnb, Tesla, Spotify, all these things, you know, and will they be there in 10 years? Who knows? But you have to use powerfully the social media networks that you do to actually make sure you connect with your patients. So, you know, they're really, millennials, nothing's off limits. They really want to be able to understand the procedure, want to make sure it's for them. And they use these tools to reach out to others. And I think some of the things that you should have to learn is that when you're doing social media, it has to be you. You can't just let somebody else do it. You have to be yourself. You have to communicate. You have to take control of your own voice. I'm just going to go through some of the various different areas. Like Facebook is a mature audience. It's more than 40 years old, but it's still the most popular in the world. So in general, it's good for SEO, but it's also good for some interesting content. And these are just some of I have like 10,000 followers. I don't have that many, but we get involved in, in informational things we're doing, educational things. You have to be careful. You don't present anything even on reconstructive breasts, because that may be censored. So Twitter is really, I think, more of a news venue, not a social media network as much. So you use it as a tool for that. And certainly I use it to promote PRS and PRS Global Open. We've done that a lot, and it increases the citations of your articles, and it helps promote real plastic surgery. And hopefully most of you follow PRS. And then my own Twitter I use for newsworthy updates on plastic surgery trends. These are all things that I do that are just things that are something that are often done, but it's mainly newsworthy stuff. Instagram is really the platform of choice. It's one that showcases who you are, and many of you probably follow me. I show my patients pre-op, intra-op, shows their insights, how they've interacted, how many people have, like in this one, it was 262 profile visits, the reach was 15,000. And then you can be yourself, and you can show your videos. You should probably do no more than one post a day. Feeds, you can do up to 8 or 10. You have to be careful because you can get censored here too, but you have to be, you have to cover up nipples, you have to cover up gluteal creases and things like that. So Instagram during COVID was very educational. We stayed in the know and made sure everybody understood what we were doing. And then post-COVID, we've now used it for, all the things we've done, updates on who and what we operate on, what we do. And then we want to promote plastic surgery, and that's really what we do with the journal. We want to increase the citation. We want to promote real plastic surgery by real plastic surgeons. And I think that's really very important. And then Instagram can be used to compete with YouTube. They actually added a 15-minute Instagram. The posts are 1 minute, and so you can add a 15-minute. Usually it shouldn't be 15 minutes, more like 5. And you can link them to the stories, can allow up to 15 minutes. Just remember, the stories are the ones that they only are up for 24 hours. The posts stay up, as do the Instagram TVs. So those are all very important. And just so you know, we also can make them personal. You can make them educational. I'm going to do a live one as well later today. And we actually, I think it's very important to interact with your consumers, but also with your followers. And then, so a story just is one that is there for 24 hours. A post is something that you really can use educationally, where we actually are educating our fellows and residents. And you can see I'm educating our residents and fellows, and they have made an amazing transformation in this. And when everybody leaves my office after several months, they really can do very good social media in almost all venues. So we capture themes. We want to catalog what you do. The icons tell you, what rhinoplasties you've posted, the September issue, the journal, all these things that are very, very helpful. And then there are certain people that really show their personality, like this Dr. Subio. He's a real character, and he really shows a lot of his humor. He's also a good artist. And then LinkedIn is a very professional one. It's a professional promotion, and it has messaging and posting. It's owned by Microsoft, so it's very good for SEO. And it can talk about all of the things you do. It can feature, your background, what you do, and you can put in recommendation letters. YouTube is phenomenal right after Facebook because it's the oldest. It's got huge traffic, huge SEO because of Google, and it's superb for patients to see that. And they really like that. Pinterest is a more of a DIY, do-it-yourself guides, but it really is good for better improved care. It's got a lot of professionals, a lot of mothers, and it's highly professional and very well done. And index, it's very visual, so I actually like it, and I get a lot of referrals from Pinterest groups on there. So Snapchat I don't use anymore because it really has been taken over by Instagram. It's certainly more graphic and less censored. TikTok is wild. It's now rapidly rising. It's highly creative and provocative. It's got, you can be easily censored. It's really the one I'm sure all of you are on. It's very fast paced. It's got music, it can be polarizing, but you can be serious as well. And I try not to do that, except I try and post things that are not, and just do things that kind of are interesting. But, it's very, very fast paced, and you can see, and you'll never know what really gets a lot of hits. It's about cooking, drama, movies, it's everything. Let me just tell you about some posting. You probably should do videos if possible, and some that aren't very graphic. Don't do, even though this one did get 25,000 views, this is too graphic today. I wouldn't use it. Static views are okay. Videos are far better. If you do a video, you get 10 times the views. So, but you have to engage them, and just remember, you have to use it regularly. And, grow it organically, be selfless, not self-promoting, and be yourself. Post daily, 1 to 2 videos, and then, and use, under 10 hashtags. So be safe, show who you are. Don't fake it till you make it. Let others speak for you. Always be positive. And, you have to promote education. Be dynamic, be interactive. And just like in websites, you really want to make sure that you promote, the best of the best, and it's visual, and you have to make sure you have your own contact information. It can't be a lot of words. People don't like verbiage anymore. And reviews, doctors are reviewed like, hotels and airlines. So the ones that are the best are ones that are on Facebook, Google, LinkedIn. The ones that are on these others are anonymous, and I think that's really a problem. The days of having written print of top doctors, except for the Castle doctors, is really, I think, something that's gone by. But you need to have a lot of reviews online. You have to make sure that it's easy to read, it's visual, it's up front. So these are the 5 commandments, I think, that are really important. Be kind, be nice, be positive, be provocative but honest. Engage your followers, be consistent, and interact with the other influencers. And then use visuals, and use hashtags. And I think one of the most important things is don't use social media to impress people, but use it to impact people. Okay, I really think you should make sure you do that. I can't overemphasize that. And I think if you follow this adage, if you don't use social media to impress people, but use it to impact people, that will really help you so much. So I'll leave you with some of these thoughts. And of course, I know we went through some of this fairly rapidly, but I just want you to know that this is your future. This is what you're going to be doing. And so those are kind of 2 different venues, one on plastic surgery advances, hot topics. And so I'll take the rest of the time here to answer your questions and get your feedback. I mean, I'm sure many of you are on social media.
Yes, we have some questions, Dr. Rohrich. The first one, I think it's more about the other topic. What is the level of scientific evidence comparing long-term results between Renuvion, the J-plasma, and Bodytite?
Well, it's a good question. I don't know what level of evidence there is for J-plasma. I think J-plasma has very little literature on it. I think it potentially can be challenging and even dangerous. I think you have to be very careful. Bodytite has a lot more science behind it. I don't know if there's been a study to compare the two.
Okay. The next one. When did you notice you need to start in the social medias, like Instagram, Facebook, and what made you include it in your mindset?
Well, we started it about 5 years ago with the journal because we wanted to promote the journal, especially our open access journal. So I really never used social media before 5, 6 years ago. You know, Twitter, but I really didn't know how to use it. But now we use it a lot, especially for the journal. I don't use it a lot for social media other than that. But, you know, Twitter is more of a news feed today.
Mm-hmm. This one, Flavio asked, oh, I'm sorry, I was muted.
No, that's fine. But I read the question. I think
okay.
I think you should start now. I mean, you know, but be very prudent. Don't overdo it. Don't do crazy stuff. You know, don't post when you're partying at night and things like that. You know, because people will look at it. You know, if you're gonna, you know, especially if you're gonna be a doctor, so you got to be careful. You know, just post things of interest that are going to be educational. Remember, you're there to, you know, impact them, not impress them.
That's right. And this one, in Brazil, we face many ethic discussions regarding if surgeons should or shouldn't do before and after patient posts on social media. And in US, this is very common. What's your opinion about this, Dr. Rohricht?
Well, I know in Brazil, apparently they can't post any patients, which, you know, is, I think, you know, it's just whatever your rules are, that's fine. But if you do post in the US, it's obviously very common. It's a way to communicate, as long as they're honest in their like I usually do videos because those are things that people can't alter. But I think honestly, you should be able to do that. It just shows you, because everybody talks the talk, very few can walk the walk, as we say in Texas.
Yes, that's it. Let me just see if there is another question. I think there isn't. Do you have some question, João?
Well, I think the biggest thing for you all is you have to understand that, you know, everything in social media is evolving rapidly. I mean, TikTok is like going crazy in the US. I'm sure it is probably in South America. Is it also?
Yes, it is. Really famous.
Yeah. What is the most common thing you all do? TikTok or Instagram or?
I think in our age, more Instagram, but about like 12 to 15 years old, I think is more TikTok that they use more.
Yep. Yeah, same in the US, but also more and more adults are coming on to TikTok. TikTok, I don't know what its role is going to be in plastic surgery. I really don't. I have no idea how it's going to be. We'll see.
Yes, things really change in the years. And we have some compliments to you, Doctor. Thank you for your great words about social media. And here, thank you so much for your elucidative conversation. And me and João, we as our representative of our plastic surgery leagues, we would like to thank you very much for sharing your thoughts with us, Dr. Rohrich. It has been an honor to learn with someone with your experience. And we know that your agenda should be extremely full, so yet you are here with us. So thank you very much. It was a really enriching moment.
Well, good. Well, listen, thank you so much. And y'all have been a great audience, and good luck to you in medical school, and hopefully many of you will become plastic surgeons, and of course, be safe, okay, with
Thank
COVID.
you, Doctor.
All right, you bet. Take care. Bye-bye.
Bye-bye.
Bye. Galera, eu só queria avisar que o link de presença eu coloquei no chat no YouTube, então lembrem de preencher para a gente conseguir fazer os certificados. E é isso, muito obrigado. Eu sei que é muito cansativo uma aula no domingo, todo mundo já está bem saturado dessas aulas virtuais, mas eu espero que tenha sido bem esclarecedor e acrescentador a aula para vocês.
Sim, obrigada a todos pela presença. Realmente foi uma oportunidade única dessa aula com o Dr. Rod, então espero que vocês tenham gostado.
Tchau, gente.